Hi everyone, welcome to another Rock County Public Health Department question and answer video. My name is Jessica Turner and I'm the Communications Specialist for the Rock County Public Health Department. In this video, I'm going to answer some questions about quarantine and isolation. Question number 1, what is the difference between quarantine and isolation? Quarantine and isolation are both public health tools that have been proven to help prevent the spread of contagious diseases. Many people use the word quarantine to refer to both of these, but quarantine and isolation are not the same thing. The difference between whether you quarantine or isolate is whether or not you're sick. Isolation separates people who are sick or who have tested positive for a contagious disease from people who are not sick. The amount of time you need to isolate is determined by how long you're contagious. You need to isolate for the entire time that you're contagious to make sure you aren't spreading the disease to others. Quarantine separates and restricts the movements of people who are exposed to a contagious disease and have a high chance of becoming sick or contagious. Quarantine is not for people who are already sick or who have tested positive for a disease. It's designed to stop the spread of a disease by catching it before a person becomes contagious so that they don't spread it to others. So one trick you can use to remember whether you need to isolate or quarantine is to think of the letter I. If you are ill, you isolate. Question number 2, what do I need to do if I'm sick or test positive for COVID-19 and I'm told to isolate? While you're in isolation, you have to stay home and away from all other people. This includes the people you live with. You should try to stay in one room and not share a bathroom with anyone if possible. You shouldn't share any items with anyone, and you should clean any surfaces you touch. If you have to be in close contact with someone, for example, if you're very sick and someone needs to take care of you, it's very important to make sure that you're both wearing masks and washing hands or using hand sanitizer. The length of isolation for COVID-19 is at least 10 days, but it depends on a couple of factors. In order to make sure you're not spreading the virus, you need to remain in isolation until you meet all of the following. Number 1, it's been at least 10 days since your symptoms started, or since your test date if you never had symptoms. Number 2, you've been symptom-free for 24 hours, or have seen great improvements in your symptoms. And number 3, you've been fever-free for at least 24 hours without taking fever-reducing medications like aspirin, ibuprofen, or Tylenol. Question number 3, what do I need to do if I'm told to quarantine for COVID-19? If you've been told that you're a close contact to someone who has COVID-19, you need to quarantine. You should stay at home and away from all other people as much as possible. This includes the people you live with. If the people you live with do not have COVID-19 and were not close contacts, they do not need to quarantine, but they should stay at home as much as possible. You can make essential trips to the doctor or the pharmacy if you need to, but you should stay as far away from people as you can and avoid contact. The CDC and the Wisconsin Department of Health Services recently put out guidance for shortening your quarantine. They both still strongly recommend 14 days of quarantine, but this new guidance is meant to balance the burden on people who are not able to quarantine for a full 14 days with the small risk that they could be spreading the disease. According to this new guidance, if you're not able to quarantine for the full 14 days and you have not had any symptoms, you can end your quarantine after day 10. Additionally, if you have not had any symptoms and you get tested after day 6 with either a PCR or antigen test, you can end quarantine after day 7 if that test comes back negative. If you end your quarantine after day 7 or day 10, you still need to monitor for symptoms for the rest of the 14-day period, and there is a small risk that you could be spreading the virus to others. We hope that this video was helpful in answering some of your questions about isolation and quarantine. Remember to always wear a face mask, wash your hands, and watch your distance. Make sure to contact your healthcare provider or visit a community testing site for a COVID-19 test if you have any symptoms or think you have been exposed. Remember to quarantine while you're waiting for your results. If you have any questions for us, you can email them to covid19.questions@co.rock.wi.us, and we will try to answer them in an upcoming video. Stay healthy, stay safe, and help do your part to keep our whole community safe and healthy too.